We continue with general adult tests. This time we talk about checking blood glucose. Glucose, a type of sugar, is the primary energy source of all body cells. It is obtained from carbohydrates in the diet and is circulated around the body in the blood. Maintaining the correct blood glucose level is essential for proper functioning of the body. Too high a level indicates diabetes. The level of glucose in the blood is kept within normal limits by various hormones. If the level rises too high after eating, for example, the pancreas releases insulin to lower the level. If the blood glucose level falls too low, other hormones, such as glucagon from the pancreas, can raise the level by mobilizing carbohydrate stores in the body. If your blood glucose is persistently raised, the cause is either insulin resistance, where the cells become less responsive to insulin, or decreased production of insulin by the pancreas, indicating diabetes. HbA1c test, also known as the glycosylated hemoglobin test. The HbA1c test provides a measure of your average blood glucose level over the previous few months. In the blood, glucose joins to hemoglobin, the oxygen-carrying component of blood, forming glycosylated hemoglobin, or HbA1c. The level of HbA1c is not significantly affected by recent food intake, so it provides a good overall picture of your longer-term blood glucose levels. The HbA1c test itself simply involves giving a blood sample for analysis. The blood levels of HbA1c may be given in terms of its concentration, millimoles per mole, or what percentage of the blood's hemoglobin is in the form of HbA1c. A level under 5.7% or 42 millimoles per mole is considered normal. You can monitor your blood glucose by using a finger prick to obtain a drop of blood, putting the blood on a special test strip, and then inserting the strip into a glucose meter. Alternatively, you can use a flash monitor, which is a sensor worn on the skin that detects glucose in the body tissues. Fasting blood glucose. This test involves checking your blood glucose level after you have not eaten for several hours. It provides an accurate measure of your general blood glucose level because the result is not influenced by anything you may have eaten. You will be instructed not to eat for 8 to 10 hours before the test and also to avoid drinking anything apart from normal or small amounts of plain water. You can usually continue to take most medications, but you should ask your health professional if you are not sure. After the fasting period, a blood sample is taken in the usual way, and the amount of glucose in the sample is measured. The blood glucose level after fasting can indicate whether you have diabetes or impaired fasting glucose, a type of prediabetes. Thank you for your attention.